Hello everyone, good morning. I'm Steve from UCAN English Tutoring. In this video, I would like to speak about the use of medical phrases, abbreviations, acronyms, and symbols in the writing section of OET examination and how we need to expand them and why we need to expand them in our letter. 9 times out of 10 in reading section of the OET examination, case notes of a patient consist of various medical acronyms, abbreviations, symbols, and short phrases. However, as a student, you need to expand them into full words and sentences in your letter. Because writing task is always 100% formal, where your ability to have the control of written English language is evaluated. If you use the same acronyms and abbreviations in your letter without expanding them, your score will be affected badly because the use of abbreviations, medical acronyms, and short phrases in the letter makes it more informal. I have got a list of commonly used abbreviations and their expansions. Let's go through them one by one. Look at this hyphen. So I will also give you the example, on how to use this. So hyphen could be to, to, okay. And the next one is ampersand symbol. If they use ampersand symbol in the case notes, you need to expand it into and. You have to write and in place of ampersand symbol. If there is plus or plus VE sign in the case notes, then you have to write down positive. If it is minus and negative sign, then you have to write down negative. If there is 3/12, then it is 3 months. If it is 6/h, then it is 6 hourly. If it is 4/h, it is 4 hourly. If there is a condition along with that, if you have a question mark, then it could be uh, in relation to the possibility or suspecting. Okay, they are suspecting something, or possibly it may have, so that's what you got to do. And if they write down ABDO, it's abdomen. If they write down AC, it is before meals. If they write down ADL, it is activities of daily living. If they write BMI, then you have to expand it as body mass index in your letter. If they write down BD or BID, it's usually by in a day, which means it's twice a day or 2 times a day. If they write down BP, then you have to write down blood pressure in your letter. Remember that these abbreviations are acceptable in the listening section, but definitely not in the writing section. So you need to understand these things, okay? Let's go through this. BPM means beats per minute. I'm sorry about that. And then BW X-rays means bite wing X-rays. C/O means compliance of or compliant of something. Cap means capsule. CM means centimeter. Though units are acceptable, if you write down the same abbreviations in your letter, I recommend my students to expand them. Okay, you need to write down the full forms of the measurements. It's not a good idea to write down the abbreviations there. If you ever write DOB, please stop doing it because we need to expand it to date of birth. ECG needs to be expanded as electrocardiograph, whereas F/hyphen needs to be expanded as fluoride application. FBC would be full blood count. FTA would be failed to attend. GM means gram. IV means intravenous. ICU means intensive care unit. H could be hour. HX could be history. KG means kilogram. L means left. Lab means laboratory. If you get MANE, MANE, along with the medication, this means that particular medication needs to be taken in the morning. Min or mins means minute or minutes. MG means milligram. You have to write down small m here as well. MI means myocardial infarction. ML means milliliter. mmHg means milligram of mercury. NAD means no abnormality is detected. NOCT means in the evening. OPG means orthopantomogram. Post-op means post-operatively. PR means pulse or pulse rate. PMH means previous medical history. PRN means as required or when required. QID means, look at these words like quarterly in a day, so which means 4 times a day. R could be right. Tab means tablet. SID means single in a day. Look at that. SID. S for single, I for in, and D for day. A day. It's once a day. TDS or TAD means, look at this, thrice in a day or 3 times in a day. So TID, 3 times in a day. So it's thrice a day or 3 times a day. If it is UEC, it's urea, and then there's another one, I forgot it. It's actually creatinine, urea, electrolytes, and creatinine. Sorry, yeah, urea, electrolytes, creatinine. Otherwise, you can write down renal function blood test, because this is a kind of special blood test that needs to be written down. And if it is WO, then it is without. It means without, okay? And if it is Y or ears, then it should be ear or ears. If they use YO, then it is year old. Okay, for example, 45 YO means 45 years old. Okay, 45-year-old. All right. I've got a list of sentences using these abbreviations. Let's go through them one by one. Look at this. The way we need to write down is this. This is the correct sentence. Okay, let's look at this. He drinks 2 to 3 glasses of wine every day. Do you remember that the first abbreviation that I used, the first symbol I used was hyphen, and I have mentioned it 2. So look at this. He drinks 2 to 3 glasses of wine every day. Remember that if the number is below 10, 10 or below 10, it is recommended to write the numbers in words like this, TWO or THREE. And this hyphen is expanded as 2, TO. Let's go to the next example. Look at this. He is a smoker and a drinker. We use the ampersand symbol here. When you have to write it down, you have to write he is a smoker and a drinker, AND. Look at the next one. Each HIV test result was negative. So it's minus VE. So which means we have to expand it as what? Negative. His HIV test result was negative. Look at the next one. He requires assistance with the ADL. Please do expand it like this. He requires assistance with the activities of daily living. Okay, Mr. James is a 45-year-old businessman. So Mr. James is a 45-year-old businessman. You have to expand it. His FBC test is scheduled in a week's time. His full blood count test is scheduled in a week's time. On examination, his PR was found to be 88 BPM. So on examination, his pulse rate was found to be 90 beats per minute. So we have expanded the BPM as well as PR. Let's go to the couple of few examples. Look at this. His current medications include paracetamol, Sidman, metformin, 500 mg bid. Okay, look at this. His current medications include paracetamol once a day in the morning and metformin 500 milligram twice a day. It is always recommended to expand the units of measurements, though it is acceptable to use abbreviations. Let's go to the next one. Aspirin is prescribed to be taken, PRN. So aspirin is prescribed to be taken when required. His ECG revealed no abnormalities. Okay, his electrocardiograph revealed no abnormalities. His BMI is 29. His body mass index is 29. His UEC test is due tomorrow. His renal function blood test is due tomorrow. Remember that UEC can be expanded as renal function blood test, because that's a specific blood test which is going to measure the urea, electrolytes, and creatinine levels in blood. So it is specifically applied for the renal function. Okay, so it's good to use Anyway, in this one. All right, let's go to the next one. Post app, comma, her weight has increased to 80 kg. Post operatively, her weight has increased to 80 kilograms. Kilograms, okay? So write it down, expand it, please. The next one is Mr. Sam's father died of MI. Mr. Sam's father died of myocardial infarction. Look at the next one. His PMI included high BP in 2003. His previous medical history included high blood pressure in 2003. So you have to expand PMH as well as BP. Let's go to the next one. Whenever you write down the reference details of the patients, you do usually write Mrs. Sandy Kaur, DOB 12 August 1988. Please stop doing it. You have to expand, DOB into date of birth, please. And look at this. IV fluids were administered for James. You have to expand it. You have to write intravenous fluids were administered for Mr. James. She has undergone R. knee surgery. That's wrong. You have to expand R. She has undergone right knee surgery. Let's go to the next example. His wound has been healing well, W and then slash O infection. I'm sorry, I didn't write N here. It was missing. Sorry about that. So his wound has been healing well without infection. So we need to expand W slash O into without. He has severe pain in his abdo. So you need to write down he has severe pain in his abdomen. All right. Mr. Jane's medications include Panadol QID. Mr. Jane's medications include Panadol 4 times a day. This cap is prescribed for him. This capsule is prescribed for him. Metformin required to be taken NOCT. Sorry about that. Metformin requires to be taken in the evening. Daily exercise for at least 30 min is recommended. Daily exercise for at least 30 minutes is recommended. This is how you have to expand the symbols, short phrases, abbreviations, and medical acronyms in your letter. If you like this video, could you please like and share it with others? I also recommend you to write down the comments about the quality of my techniques. If you really love to get regular updates and notifications on the videos which I'm gonna upload regularly, I recommend you to subscribe to my YouTube channel. If you wish to get your speaking and writing skills assessed at free of cost, you can send an email to me at steve@ucanenglishtutoring.com. Otherwise, you can reach me on my mobile or WhatsApp number, that is +61 468 480 877. You can also contact me on my Facebook page, that is www.facebook.com/ucantutoring. I have got my website as well, that is https://ucanenglishtutoring.com. I have been helping over 12,000 students since 2008 in all 3 different formats of the examinations, such as OET, IELTS, and PTE. Your first letter and first speaking roleplay cards are assessed at free of cost. I'm going to provide you an accurate assessment that is in line with the OET examination criteria, and you should be able to get excellent feedback from me, which is word by word plus the assessment against each parameter of the criteria and the overall score, which helps you to identify where you are standing on in the scale of 0 to 500 in both writing and speaking sections. Thank you so much for watching this video. I really appreciate your time. Thank you. Have a good day. Bye.